Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Doug Iliff of Topeka about drug reactions. Thanks for being here today, Dr. Iliff.
You're welcome, Amy.
How does a patient recognize a drug reaction?
Well, that's a lot more difficult question than it sounds. Let's divide them into three categories: serious reactions, rashes, and everything else. And to take the serious reactions first, if you get chest pain or shortness of breath, or you get swelling, especially around the neck or the face, obviously you need to stop taking whatever drug it is you started on, but you probably need to go to the emergency room right away.
How do you know if a rash might be due to a drug?
Well, rashes in general are difficult to diagnose, but a drug reaction will generally be a generalized rash. That is, it'll cover a widespread portion of the body, the whole trunk or the arms and the trunk and the legs. Whereas something like poison ivy will be streaky or patchy. Another hint is that some drugs, like doxycycline, for instance, which many people take for bronchitis or chronic bronchitis or acne, are known for photosensitivity reactions. And with those drugs, what you're going to see is a red rash that's all coalescent, usually just in the sun-exposed area of the body.
Okay. What about everything else that someone might notice?
Well, that's where it really gets difficult. And the problem is that when a patient starts on a new drug and they experience something unusual, and they go to look it up in the internet to see what kinds of reactions that drug causes, they're going to find very common things. They're going to find nausea, they're going to find headaches, they're going to find dizziness, the kind of things that 5% of the population is experiencing at any one time anyway. And so it's really tough to know if this is due to a drug or something else. Take statin drugs, for instance. A very common reaction to statins, which we use to treat hyperlipidemia, is to get muscle aches or joint aches. Now, what I'll tell patients, it's about 20% of patients will have that sort of symptom. I'll say, look, if you get muscle or joint aches when you start this drug, then you need to stop it. Now, I understand that statin drugs are common in men over 50, and in men over 50, almost all of us have aches of some kind or another every day anyway. And so if you stop the drug and whatever you're experiencing in the way of muscle aches goes away, then great. A week later, you start it up again. If they come back, now you know that you've got it. That's one way to try to figure it out.
All right, good information. Thank you for being here today.
You're welcome.
Please join us next week for an all-new health topic discussion on House Calls.